Hello, and welcome to Western Kentucky University's Global Learning Forum. My name is John Sunnigard, and I'm the Associate Provost for Global Learning and International Affairs here at Western Kentucky University. Today is a really exciting day for us. The Global Learning Forum is an opportunity for us to share at Western with our students, with our faculty, with colleagues abroad, different aspects of what's happening in the world and how we're thinking about it. And today's a special presentation because we're going to be speaking with Dr. Takyi from Accra, Ghana, about how Ghana has been responding to the COVID pandemic and what kinds of things the United States might learn. I'd like to begin by handing things over to my colleague, Christian Coco, a Western Kentucky University student of applied economics from the Democratic Republic of Congo, who's going to take us through and help us ask some questions of Dr. Takyi and be the moderator. So just a couple things that I'd like to ask all of you. First of all, please send us questions. You can do so through Facebook or YouTube or however you're accessing it. Secondly, we are dependent upon technology, and we're functioning in two very different time zones with different sets of internet connection and so forth. So please bear with us. We may be joined from some colleagues here in Bowling Green. But as promised, I'm very happy to turn things over to my dear colleague, Christian Coco.
Hi, everyone. I'm super excited about the conversation that we're going to have today. Joining us today is a pioneer in emergency medicine in Ghana, and he was a lead clinician for the COVID-19 Center at the University of Ghana Medical Center. Our guest speaker today is an emergency medicine fellow and the current head of emergency medical services at the University of Ghana Medical Center in Accra. Also, is a founding head of the Accident and Emergency Department at the Tamale Teaching Hospital and the University of Ghana Medical Center. Today, he will be sharing how Africa, and especially Ghana, is mitigating the pandemic of COVID-19. Let's welcome Dr. Godfred Takyi. Dr. Godfred Takyi, we are glad to have you here. Thank you so much for joining us today. Among our panelists, we are glad to have a professor of WKU. She's a director of undergraduate program in public health at WKU. Let's welcome Dr. Grace Lartey.
Thank you.
It is so good to have you here. Again, thank you so much for joining us.
Thank you.
Welcome, Dr. Godfred Takyi.
Thank you, Coco. I'm excited to be here today to lead the discussion and share some experiences in the context of Ghana's COVID-19 response. Before I start, I want to wish all women a happy International Women's Day. And I hope we'll get a lot of questions from the ladies since today is your day. So, as Coco said, I am Dr. Godfred Takyi. I am an emergency physician fellow and the current head of emergency department at University of Ghana Medical Center in Accra. So before I proceed, let me tell you a little bit about the country Ghana and Africa as a whole. So Ghana is in Africa. So Africa is the largest continent, second largest most populous continent in the world. There are 54 sovereign states in Africa. There are 2 territories that are disputed over, that is Somaliland and Western Sahara. There are several languages on the continent, different culture, no uniform policy or structure. However, Ghana is located in West Africa. Ghana has a landmass size of about 238,535 kilometers squared, which is almost about the landmass of the states of Georgia and South Carolina in the USA. The population of Ghana is about 31 million. The official language in Ghana is English. And life expectancy here is about 64 years. So 64 years for males and 66 for females. But overall or combined life expectancy is 64 years. There are 16 regions in Ghana. However, I want to say that I work at the University of Ghana Medical Center, which is a quaternary medical center for medical research, training, and care. So as I said, Ghana has, as you can see on the slides, Ghana has 16 regions. It was initially we had 10 regions. Just a few years ago, additional regions were created, and now we have 16 regions. Okay, and I live currently in Accra, which is the capital of Ghana. Okay, I work at the University of Ghana Medical Center, which is a quaternary medical and research center located on the campus of the University of Ghana. Okay, that is where I work, and in the line of my duty, that took me into contact with the fight or join the fight against COVID-19. So on the 12th of January, 2020, the WHO, which is the World Health Organization, confirmed that the novel coronavirus was the cause of a respiratory illness that affected a cluster of people in Wuhan City, Hubei province in China. WHO also declared COVID-19 a pandemic on the 11th of March. However, in Ghana, we got our first 2 cases on the 12th of March, where 2 travelers arrived in Ghana, one from Turkey, one from Norway, tested positive. What helped us to mount a good response and preparedness for COVID-19 was the fact that during the 2013-2014 Ebola pandemic in West Africa, we just to help us prepare, just in case we get some imported cases of Ebola. And that was a very useful template that helped us to set the ball rolling to prepare our fight as a nation against COVID-19. Most people, as we all know, who get COVID-19 will have various symptoms. But the most common symptoms I have seen in my practice in Ghana include fever, difficulty in breathing, runny nose, diarrhea, sore throat, tiredness and myalgia, diarrhea, conjunctivitis, headache, loss of taste, and loss of smell. These are the common symptoms I have encountered, but we know people may present with different symptoms, okay? So to date, as a country, we've recorded 86,465 COVID cases with 80,952 recoveries of discharge, giving us a recovery rate of slightly over 93%. Unfortunately, and I must say unfortunately, about 647 people have died to this disease or pandemic. So currently, as of today, our caseload is 4,866. I know the slide there is, we've had some small increments in the caseload. So our caseload now is 4,866. The age distribution for COVID-19 has remained relatively the same comparing the year 2020 and 2021, though we are just in the first quarter of this year, but the age distribution has remained relatively the same. Okay, now let's get into the real action. What did Ghana do differently? So one, we talk about the country response to COVID-19. The first thing we did as a country, let me say this, I'm looking at what we've done so far through the lenses of an emergency physician. There could be a different perspective from a public health person or a politician. So bear me out. This is through the lens of an emergency physician, okay? So the first thing we did was to set up a national technical coordinating committee, which was at the seat of government, that's at the presidency. So the president, His Excellency Nana Addo Dankwa Akufo-Addo, appointed a seasoned healthcare professional who was a former Deputy Director General of the World Health Organization, as the presidential coordinator for the country's COVID-19 response program. In that role, this person was to coordinate and pool resources to help make sure that we are on top of fighting this disease. And as I said, this was at the seat of government. The president himself was involved. So this is leadership par excellence. And we all know that when you are taking certain decisions that you want it to work very well, you need commitment from the top. Because without commitment from the top, everything breaks down. So, Mr. President, we thank you. The next thing we did as a country was to set up a national task force with regional coordinators. So basically, they set up the treatment centers, so areas where moderate and severe to critical diseases will be taken care of, holding areas at all care facilities, training of healthcare professionals nationwide. The regional coordinators, who were clinicians, were to coordinate the movement of patients from one facility to the other with the use of ambulances. So special ambulances were designated for COVID duties. Let me say here, I'm not trying to make a popularity stunt for our president, but the timely arrival of the ambulances in this country made the work of our COVID movement of patients with COVID from one facility that are very efficient and easy. Without these ambulances, I don't know what we could have said of how we're going to transport patients with COVID. So here too, I want to say kudos to Mr. President. We also activated our already existing Public Health Emergency Management Committee to enhance surveillance for any person at all in the various regions with symptoms suggestive of COVID-19. Then executive decisions kicked in. So there was a restriction on public gathering and movement. So the president of Ghana imposed a ban on all public gathering, including conferences, workshops, funerals, festivals, political rallies. Don't forget, last year was 2020 was our political year, where we go to the polls and choose a president and parliamentary candidates. But there was ban on political activities as well, church activities, and other related activities that lead to congregation of people to reduce the spread of COVID-19. Basic schools, senior high schools, universities, both private and public, were also closed down. However, school pupils and students who were preparing to sit their basic and senior high school exams were permitted to remain in school under strict adherence to COVID-19 protocols. As a country, all our borders were closed, as in land, air, and sea. They were all closed. Passport services were suspended. Traveling to Ghana from other countries that have recorded over 200 cases of COVID-19 was not accepted. When you come, we'll turn you away. And all Ghanaians who were returning and other non-Ghanaians who had resident permit to live in Ghana were allowed to come into Ghana subject to mandatory quarantine for 14 days and testing before you are allowed to leave your quarantine area. A new law was enacted which criminalized the non-wearing of face masks at public places. We disinfected and fumigated over 500 markets across the country. We fumigated also a lot of our secondary schools, and public institution buildings were all fumigated. Some of our citizens that were trapped in other countries, like Lebanon, over 2,000 of them were evacuated from Lebanon. By the time the evacuation ended, we had moved over 9,000 Ghanaians and persons living in Ghana with permanent residence from countries such as South Africa, the Gambia, Ukraine, United Arab Emirates, United Kingdom, United States of America, China, Benin, Burkina Faso, and Togo. These people were all brought home. All this cost money. So now let's talk about financial response and incentives, including waivers. So an amount of 100 million US dollars was made available to enhance the Ghana coronavirus preparedness and response plan. the Ghana COVID-19 private sector was also initiated. So the fight against COVID-19 was government-led, but we also had a lot of support from the private sector in Ghana. There was also the launch of the Coronavirus Alleviation Program Business Support Scheme, which was part of government's intention to provide support to micro, small, and medium enterprises who were affected by COVID-19 in the country. All this initiative of government actually created over 21,000 jobs under this scheme. And these jobs were mainly among young people like you and me. Also, over 110,000 micro, small, and medium enterprises that were saved were actually owned by women who benefited from this intervention by Ghana government. There were also relief packages for some private institutions who were affected by the shutdown of schools. Accra was locked down for 3 weeks. It was a partial lockdown of Accra, Kumasi, surrounding cities around Accra were all locked down partially. There was tax waiver incentive for frontline health workers. There was also free electricity and water for the populace. All these geared towards helping people to adhere to the simple rules of hand washing, because if you don't have access to potable water, you can't follow some of these simple protocols. Let me say that there are a lot of things in the United States that you may take for granted, but having access to potable water, it's not something that is taken lightly in this country, because not every part of the country have such access. It's work in progress, and I'm happy with the progress we have made as a country. Government also put in measures to help alleviate the suffering of a lot of entrepreneurs in the northern parts of Ghana, which is traditionally referred to as a poor region of the country. Government also reduced the communication tax because most people were at home. So they will be using a lot of the internet, talking on the phone. So in order to alleviate the suffering of all this group of people, including myself, government reduced tax. Now let's talk about the medical response. Designated areas for treating COVID-19 were created nationwide. Then this also led to the construction of the first ever Ghana Infectious Disease Center at Kwabenya. I'll talk about that later. Ghana also began the local production of nose masks, medical gowns, medical scraps, and all in all, by the end of the year 2020, we had produced over 18.8 million face masks in this country locally. So UGMC was designated, UGMC is University of Ghana Medical Center, where I work, was designated as a COVID-19 treatment center. And we took care of all categories of COVID-19 patients, from mild, moderate, severe to critically ill patients. So we had a special OPD services for people who think they have any of the symptoms, but don't necessarily require hospital admission, but wanted some form of care. So we gave that service to the Ghanaians. Okay, our ICU also served as the national center for severe to critically ill COVID-19 patients. And we were the first hospital in Ghana to take over the management of pregnant women with COVID-19, including cesarean section. Now let's talk about the testing facilities. At the onset of the pandemic in the early parts of March, only Noguchi was able to test for COVID-19 or SARS-CoV-2, the virus identified by WHO as causing COVID-19. Noguchi was the only facility, Noguchi Memorial Institute for Medical Research was the only facility in Ghana, medical facility, that was testing for COVID-19. Some few months down the line, with the efforts of government and other partners, I can say confidently now we have about 19 testing centers in Ghana where you can do your COVID-19 test, which include private facilities. On technology, government launched the Ghana COVID-19 tracker. We also improvise Veronica buckets. I'll show you images of that later. We improvise Veronica buckets. It was found almost everywhere where people were using it to wash their hands. And necessity is the mother of invention. During this COVID-19 period, we saw a lot of innovative ideas among Ghanaians. One caught my eye was what we call the solar wash, which is an automated and mobile hand washing machine powered by solar panels, which was invented by a gentleman in Kumasi called Richard Quatin, which made some of us very, very proud. Ghana also became the first country to use medical drones in partnership with Zipline Company to transport COVID-19 samples to the testing centers. And let me also say that even during the recent vaccination, we applied or we used the medical drones to deliver vaccines to certain parts of the Ashanti region, including some hard-to-reach areas. There was also the development of an implementation of a COVID-19 AI software, which assisted to detect changes on a chest X-ray, which were suggestive of COVID-19. UGMC was also not left out in this technology. Together with Farm Access and the Ministry of Health, we launched a novel idea in Ghana for COVID-19 called the COVID Connect, where we use an app called the Lucy app. So COVID Connect is an innovative digital service which allows virtual access to a dedicated medical team at UGMC to monitor key symptoms of COVID-19 from the comfort and safety of your home. We provide you with which provides you with quality medical support and advice with seamless connection to expert psychological counseling and in-hospital management if needed. So for me, this service was very, very useful because we were able to manage patients at home who didn't need to come to the hospital. And when people's symptoms change, warranting hospital, we arrange and they are picked up and brought to us for care. I really enjoy using this service. Let me also say that a local company in Ghana by name Yamachi Biotech, in partnership with the West African Center for Cell Biology of Infectious Pathogens, WACBIP, have been able to provide a critical real-time information on the evolution of the SARS-CoV-2 virus across Ghana. I am not aware of any country in Africa probably doing this. So what is the relevance of genome or genomic sequencing? It's useful so that you can track the virus, so that when the virus is changing, you can tell which variants are in our system. As it stands now, we've been told that there are about 4 variants of concern or interest by WHO. And this is the one first identified in the UK, which is the B1117, the one identified in South Africa first, the B1351, and the one identified in Brazil, the P1, sorry, and the one identified in Nigeria, the B1525. So in Ghana so far, for Greater Accra, the predominant strain in Greater Accra right now is the UK variant. So I'm not surprised that informed our choice of vaccine, because the UK variant studies have shown that is efficient and effective against the UK variant when you use AstraZeneca vaccine, which we are using currently in Ghana. So let me say I'm grateful and I'm really proud as a Ghanaian to know that there's a Ghanaian company, local company, actually doing this. I'm happy. So now let's talk about relief and ease of restriction. Human beings by nature don't like to be restricted. So we can't restrict human beings forever. So it came as a big relief to most of us when we started easing restrictions. So we started by, first of all, lifting the 3-week lockdown on Accra, Kumasi, and surrounding areas around Kumasi and Accra. Was a big relief. All businesses that were closed down started experiencing some ease, because hotels that were closed down, bars, restaurants, were all now open, but with limited numbers to take or use at the time. And they are supposed to adhere or follow strictly the COVID-19 protocols. Churches and funerals were allowed to take place, but under the safety protocols and preventive protocols of COVID-19. So for funerals, they were not supposed to be more than 100, and the same cut across for most of the gatherings, okay? By June last year, almost all the schools that were closed down were reopened under strict COVID-19 protocols. However, for the rest of the year, all nursery, kindergarten, primary students were asked to take the rest of the year off, which we have still been doing till date. We have our kids at school and we are monitoring the situation. We've had some few reported cases in some schools, but they are not severely ill, they're not moderately ill. Most of them are even asymptomatic. So it's not a dire situation. We'll keep observing the trend. Next slide, please. So the role of vaccines and vaccination. Ghana was among the first countries to receive the COVAX vaccines, and we had 600,000 doses of the AstraZeneca vaccine, and administration started on the 2nd of March 2021. As at close of today, according to the Ghana Health Service, over 200,000 Ghanaians have been vaccinated, and we've not had any severe adverse effects. We've had the usual pain on the site of injection, myalgia, headache, feeling feverish. I must say I've experienced the same symptoms, but I'm still here giving a lecture or leading a discussion. So for those of you who have the opportunity to take the vaccine and you've not gone for it because you are probably too engrossed in following social media conspiracy theories, I, Dr. Godfred Takyi, want to recommend to you, please, if you get an opportunity to take the vaccine, please go ahead. So as you can see in the image, that is the President of Ghana, His Excellency Nana Addo Dankwa Akufo-Addo, taking his first shot to demonstrate to the Ghanaian populace that the vaccine is safe, and here too he is leading by example. Thank you, Mr. President. And he was not the only one who took the vaccine. He was followed by his wife, the First Lady, the Vice President, and other executive and Council of State. All the top hierarchy of the governance structure in Ghana have all followed suit to tell the general public that it is safe. So come and take the vaccine. So this image, I put it up here to show what we can do when we put away our difference and come together for a common good. During the COVID-19, we realized that as a country, we needed something like this. We needed an area or as part of our healthcare system where we could actually take care of infectious diseases. So through public partnership, this structure was built. It started in May. Next slide, please. So this is the completed building. As you can see, it's a 100-bed capacity infectious disease center. It was the first. Others are underway. It's not the only one being built. So I want to thank the private sector for helping government and all of us to have such a nice facility that can take care of COVID-19 and other future infectious diseases. So I put this image here just to illustrate the local production of face masks and gowns and the rest. Hitherto, we're importing everything. So this shows that there's capacity to do a lot of things for ourselves. You have to take COVID for people to become very, very innovative and do things that they wouldn't have done. Let me also say that a lot of our alcoholic beverage companies also produce a lot of alcohol-based or hand sanitizers for us to use during the pandemic. So these are all nice things coming out from the pandemic, which I think we should continue as a people, and which I will recommend for other countries to emulate if they haven't started already. Thank you. This image is just PCR testing at Noguchi Memorial Institute for Medical Research. Next slide, please. Fumigating and disinfection of public buildings and markets. These are an image to show Zoomline doing fumigation exercise. Zoomline is a local company in Ghana, and I think they work in other West African countries, and they are very useful in our quest to become a very clean city in Africa. So the picture you saw of Accra was how Accra was very empty, almost empty during the lockdown. So this is the vertical bucket I was talking about. It's very simple, low tech, but very useful. You wash your hands so that at least you're also abiding by the hand washing etiquette of COVID-19, or as part of the IPC, Infection Prevention and Control. I didn't put an image of the solar wash. I couldn't get that one, but that's also another innovation locally from Ghana, where the solar panels power a hand washing machine. Okay, next slide. So at the Kotoka International Airport, an ultramodern service was put up which does an antigen test of all passengers entering Ghana to make sure they don't import COVID-19 into our country. And as part of that, in collaboration with Noguchi, they were also routinely doing genomics or genome sequencing to find out what type of variants are coming into our country. So far, with the assistance of the local biotech company, Yamachi, and WAPBIP, and partly from Google. I actually understand Google gave them some funding where they've been doing real-time genomic sequencing. And in Greater Accra, the predominant strain here is the UK variant. In Greater Accra is the UK variant. But this service by Yamachi and WAPBIP is a real-time sequencing. So as the genomic sequencing changes, we get to know what variants are now coming in. If there are more, then that will help decide what type of vaccines we should go for. Because as I've said, the UK variant, the vaccine we have now from AstraZeneca responds very well to the UK variant. So if we start seeing different variants like the one in South Africa or Brazil, Nigeria, then we may have to choose a vaccine as a country that would help the country. So you see how the usefulness of genome sequencing can help influence or a shift in what type of vaccine we should go for. Next slide, please. So basically, I think I'll end my presentation here and wait for more questions.
Thank you so much. Thank you so much, Dr. Godfred Takyi, for the wonderful presentation. It was amazing to learn how Africa has been implementing both global and indigenous scientific and technological capacities to cope with the pandemic of COVID-19. So we're going to have a few questions. Remember, if you have a question, put it in the comment section, and our panelists will be happy to answer it. The first question: what strategies have been implemented to reduce vaccine hesitancy among the general population? Great question, Divine.
Okay, Koku, can I go ahead and try to answer that question?
Yes, please.
Okay. Before the vaccines were brought into Ghana, a public announcement was made. And so Ghanaians knew we were expecting some vaccines. And there were a lot of myths flying around in the media, social media in particular, about when you take the vaccine, you become a Chinese, you turn to a crocodile. All sort of funny things were said. Some said it's being used to make us sterile so we can sort of, bring our offsprings and all sort of things. But in Ghana, there was a lot of talk about it. And when the vaccine came, they made a lot of media attention so that Ghanaians will know the vaccine has come. Then the president was the first to take the injection, followed by the first lady, vice president, other leaders in our three arms of government. That's executive, judiciary, legislature, and council of state. Then leaders in the health sector, including myself and my chief executive officer and our medical directors, our directors, everybody has been taking the vaccine. So all this, we believe, is putting confidence into the Ghanaian people. And that's how come within 5 to 6 days, we have over 200 people vaccinated. And we only hope the numbers will get more and more and more. Thank you for the question.
Tanzania has no plan to accept coronavirus vaccine. Tanzania's President John Pombe Magufuli has faced international criticism of his dealing with COVID-19 pandemic. What is your opinion on how Tanzania government react to his global pandemic? Good question, Alinoti.
Thank you for the question. This question is tricky, and it's every country is sovereign. They choose what they want to do. Maybe WHO and other African partners, CDC Africa and the rest, can engage Tanzania more on this. But one thing I want to say is that if Tanzania, assuming all these are done, and Tanzania still does not take the vaccine, we may have a problem as a continent and as a country. As a global community. The reason being that it is known that the more the virus stays in the community, the more it evolves into more virulent strains. So if one section of a group of people in Africa decide not to go for the vaccine, and the virus becomes more virulent, then we'll be in trouble. So I think all efforts must be made to appeal to Tanzania through all available, diplomatic channels to get this resolved. Thank you.
All right. Thank you so much. I just wanted to add something to what Dr. Takyi said, answering the first question. One thing Ghana has done and they continue to do is to use the religious organizations to get to the people. So whatever religion people believe in, they are really using them. And on the 2nd and 3rd of March, I saw a lot of pictures circulating around in the media telling everybody, hey, we have gone for it. Your church leader has gone for it. He hasn't changed yet, so go ahead and take it. And the other thing is to use forums like this. We are so privileged to have the people amongst us. And Dr. Takyi, we can't thank you enough. I didn't even know you. We just connected through somebody. And it's so wonderful to have the people who are the front line, who see all these problems, have the knowledge, and so willing to pass it on. Tanzania as a country, yes, it's the president who is saying it, but we also have some, WKU has Tanzanian students and faculty members who are going through this. So it's up to us, wherever we are coming from, to also educate our friends, our family members, and let us advocate for them. Because this is something that if one person does it and the other person doesn't do it, well, it can come back to haunt you. Thank you.
I just want to add something. I forgot about it. We use a lot of traditional leaders as well, in addition to the regional leaders, because the Asante Hini, the king of the Ashanti Kingdom, got his vaccination and it was all over. He saw the chief imam, the head of the religious, Islamic religious group in Ghana. So all this help. Thanks for adding that, Prof. Thank you.
Thank you. There is one question. If you sat with Dr. Vochi, who is responsible of COVID response in America, what is one tactic you would share with him?
It's tricky when you are talking to senior colleagues. It's tricky, but let me try. And naturally, I'm a very modest person, so I don't like taking glory or anything. So let me try. Maybe the first thing I would say is that when COVID started, from far, from Ghana, looking at the US from here, it looked like the response was a bit slow. Because when I can be wrong, but that's what I saw. When we started closing down our borders, as in land, air, and sea, flights were still coming in to US from all over the places, and people were downplaying the virus. And so if I'm to give him one, he said one, right? One tactics. They should have closed down the country as quick as possible, and also do what we did here, where if you enter the country, you're a citizen, mandatory quarantine. You're not allowed to go to your family. Okay, but we are social animals. We interact. So if I have COVID and I don't know, and I interact with someone, by the time I may be showing symptoms or getting sick, I've already had an encounter with over 10 people who might also have another contact of 10 before you see the whole town is sort of infected. So my one thing I would say, there's more I would say, like what I say is one. One is prevention. And we know in IPC, the highest is what? Engineering, elimination engineering. So if you prevent, it's better. So if US has shut down their country early enough, like what we did in Ghana, probably it might have helped. That's the first thing. If you say one, that's what I would say for them.
Thank you, Doctor. Thank you, Dr. Godfred. Another question. The US and other wealthy countries have purchased much of the global supply of COVID-19 vaccines. How does this impact countries like Ghana? Why does it matter to the US?
I'm happy through the COVAX facility, we have some vaccines here, and we are expecting more vaccines to come. Yes, it's true. There are a lot of wealthy countries in the West. We heard in the news, they've made orders for tons and tons of millions of doses of vaccines. For Ghana, what I know from monitoring information from our Ministry of Health is that we have made plans to purchase or buy some vaccines in addition to the ones that we are getting from COVAX, okay? But for countries that cannot buy, because although we are in Africa, we are at a different level of purchasing power. For countries that cannot buy, using even a Tanzania example, assuming Tanzania wants to buy, but they don't have money, I know they can buy, and they don't buy. The reasons I gave are the same. If they don't, the Western world doesn't help them to take care of the people in the country with COVID-19, and we get more virulent strain. Now that it's a global village, there's a lot of traveling up and down. They may get it back in their country. Don't forget what happened in Ebola. They got Ebola in US. So it's that's why I'm happy the COVAX initiative is also supported by a lot of these wealthy countries. So I'm sure they've thought about all this as a public health measure to help countries like Ghana and other countries that are not in their category of wealth. Thank you.
Thank you, Dr. Godfred. Another question. It appears that COVID has been more widely diagnosed in those of a younger age in Ghana than in the United States. Is this because the overall population is younger in Ghana? I also know that senior nursing homes were hotspots in the US as well.
So he has answered himself. He said, is it because they are young people in Ghana? Yes, we have a very young population. So I think that is why. Because if majority of the people in the country are young, and you do a risk profile and you test people, because majority of them are young, you find a lot more. And young people tend to move about a lot than old people. And we also don't have care homes, hospice. We don't have a lot of those in Ghana. So those could affect the dynamics. Those are my response. I don't know if Prof wants to add something.
What role have religion and traditional medicine played in fighting COVID-19 in Africa? Great question, Fatin.
Okay. Thank you, Fatin, for the question. At the moment, I am not aware officially of any traditionally approved or locally approved medicine in Ghana to fight COVID-19. There have been social rumor issues here and there, but I don't have an official source from our FDA actually recommending any herbal preparation or traditional medicine. For religion, as I said, most of our religious leaders sort of are aware COVID-19 is real. They helped the government when we closed down such facilities. And when we reopen them, they are adhering by the small numbers as per the directive from the Ministry of Health. And I think they've been cooperating with the Ministry of Health so that we don't have a situation on the hand where we've not had an issue where most of the religious bodies are sort of saying they don't believe in COVID and so they should go to church. If anything at all, to be in the minority. I think they have been very cooperative.
Thank you, Dr. Godfred. Let's have Dr. Grace Lartey.
All right. Yes. Well, we do science-based theories, and most of our technology and ideas come from science. So right now with allopathic medicine, that is what we know. We know the virus, we know what is working, and we know how it is working. We are from Africa, so definitely there is the banana leaves, there is the pineapple leaves. We have not been able to prove those yet. Please understand that there is that complementary alternative treatment. We know that, but we have not been able to prove that yet because this is a new virus that we are dealing with. So maybe with time we may come up with certain things, but right now we don't have anything to prove that something works besides what we know. Thank you.
Does the Ghana government work with the United States government on COVID-19 issues? I think this question has been asked before. Maybe if you could answer it, it could be great.
Yeah, we get support from a lot of countries, including the US. Okay, I know that when COVID even started in Ghana, we got support from the United States government through USAID to train all our coordinators in the regions, the 16 regions and all that. So as for support, we get support all the time from the States, okay? But we adapt the support to suit our local needs and interests, okay?
Dr. Joe, could you unmute?
Sorry. Thank you very much, Dr. Takyi, Dr. Lartey, Coco. This has really been wonderful, and it just makes me think so much of how important it is that we pay attention to what is happening in other parts of the world. Because for too long, the perception has been that problems are somewhere else and solutions come from the United States or from the West. And it's very, very clear from what you presented, Dr. Takyi, that there are a lot of, that first of all, Ghana has done a remarkable job of managing the pandemic, but also of applying its different technologies, the Veronica bucket, from the Veronica bucket to the solar wash, and drones, medical drones, which is amazing, artificial intelligence, channeling all those things through to help, address the problem before it becomes a big problem. And so I really encourage all of us to be looking out at other countries, other ways that people are addressing and solving, so that we can learn how to do a better job ourselves. And also the importance of working together to share solutions, not just things like, vaccine technology and so forth, but also those, down to earth technologies that make so much of a difference from preventing the thing from spreading in the first place, like the solar wash and the Veronica bucket and things like that. So again, I want to thank Dr. Takyi. Thank you so much for taking the evening after work and spending some time with us. Dr. Lartey, I want to thank you so much for what you do with our students here on campus, and for the work that you've done with us on the Global Learning Forums. I'm looking forward to doing some more with you, and for introducing us to Dr. Takyi. It's been great. Thank you. Coco, thank you so much for the fine job that you've done working with us to pull this off. It's so great to have a student voice.
Thank you, Dr. Joy.
I just want to say that the University of Ghana Medical Center is a quaternary center, the only of its kind at the moment in West Africa. So if you have people within a sub-region where you want a warm, friendly interaction of staff dedicated, who puts the patient at the center of the care, where you are assured of quality care in the West Africa sub-region, then you must come to University of Ghana Medical Center. Our website is ugmedicalcenter.org. You can have all the bookings, discussions before you send your patients. And I want to say thank you to Dr. Bonku, who connected me to all of you, and also thank you to my Chief Executive Officer, Dr. Darius Osei, for giving me the opportunity to use this space. And thank you, Prof, and all of you. Thank you very much.
Thank you.
Thank you. Thank you so much, Dr. Godfred Takyi. We were so glad to have you. Thank you so much for your time, and thank you so much for this wonderful presentation. Thank you so much. Okay, so have a good rest of the day.
Thank you.
Thank you.
Bye.
Take care, everyone.
Bye.
Have a good evening, Dr. Takyi.
You too. Bye-bye.
Bye.